If you're a man over 60 and you've noticed that things don't work the way they used to, I need you to watch this entire video. Because what I'm about to tell you is not what most doctors are telling their patients. And it's not what the pharmaceutical companies want you to know. The answer isn't a pill. It's not a hormone injection. It's something sitting in the produce aisle, and the science behind it is genuinely remarkable. I'm a physician who specializes in aging physiology. I see men in their 60s and 70s every week who are embarrassed, frustrated, and quietly losing confidence, because no one has ever explained to them what is actually happening inside their body. So, today, I'm going to explain it clearly. No fluff, no selling, just the science. Here's what most men get wrong. They assume erectile dysfunction is a testosterone problem. It's not. In the majority of men over 60, the real culprit is blood flow. Specifically, the ability of your blood vessels to open, relax, and stay open under pressure. The penis is not a muscle. It is a vascular organ, and those vessels, as we age, become stiffer, more inflamed, and less responsive. This is why medication stops working for so many men over time. You're treating the symptom, not the system. There is one molecule your body absolutely must have to produce an erection. It's called nitric oxide. Nitric oxide tells your penile blood vessels to relax and fill with blood. Without enough of it, firmness is impossible, no matter how much desire you feel. Here's the problem. After age 55, your body's ability to produce nitric oxide drops significantly. The cells lining your blood vessels, called endothelial cells, lose efficiency. Oxidative stress increases, inflammation rises, and nitric oxide breaks down faster than it can be made. This is also why erectile difficulty often appears years before heart disease. The penis is one of the first places vascular decline shows up. It is your body's early warning system. Now here is where one specific food changes everything. Beetroot. Beetroot is one of the richest natural sources of dietary nitrates on the planet. When you eat it, your body converts those nitrates into nitric oxide, but through an alternative pathway that bypasses the aging system that's slowing down. This pathway, through saliva and gut bacteria, remains active even in older adults. That is the key. That is why beetroot works when other things don't. This isn't anecdotal. This is published research. Clinical studies show that beetroot consumption improves blood flow within hours. In older adults specifically, regular intake has been linked to improved arterial flexibility, lower systolic blood pressure, and better oxygen delivery to tissues. And there's a neurological component too. Studies in older adults show increased frontal lobe blood flow after nitrate-rich meals. Better brain circulation means better nerve signaling, better arousal response, better results. Beetroot also contains compounds called betalains and polyphenols, which reduce oxidative damage to your red blood cells and fight the chronic low-grade inflammation that stiffens arteries after 60. If you have diabetes, prediabetes, or metabolic syndrome, this is especially relevant to you. Those conditions are strongly linked to erectile dysfunction, and beetroot directly addresses the vascular inflammation driving both. So how do you actually use this? Timing matters. Morning consumption, ideally on an empty stomach or before breakfast, is most effective. Blood flow improvements peak within 2 to 3 hours and can last most of the day. Form matters. Whole cooked beetroot, lightly steamed or grated raw, both work well. Fresh beetroot juice works faster, but if you have a history of kidney stones, dilute it or stick to whole beetroot. Half a cup of cooked beetroot or 1 small glass of diluted fresh juice in the morning. That's it. This is not about large quantities, it is about consistency. And here's what not to do. Smoking destroys nitric oxide. Excess alcohol disrupts vascular tone. Late-night heavy meals impair circulation. If those habits stay, no food can fully compensate. Beetroot is not a stimulant. It will not cause a sudden erection. It does not override medical conditions. What it does is restore vascular responsiveness over time. Many men report that after a few weeks of consistent morning use, morning erections slowly return, firmness improves, duration improves, and with that, confidence returns. These are subtle changes, but they are real physiological changes, not artificial stimulation, actual repair of the system that produces erections. One important note, If your erectile dysfunction is sudden and associated with chest pain, severe fatigue, or breathlessness, stop watching and call your doctor. That is a medical emergency, not a nutrition issue. Also, if you are already on nitrate medications for heart disease, or if you have very low blood pressure, speak with your physician before adding beetroot regularly. The combined blood pressure effect can be significant. Here's what I want every man over 60 to understand. Aging does not shut down erectile capacity. It narrows the margin for error. Your body becomes less forgiving. Your blood vessels need more support. Your nutrition needs to become strategic. Stop thinking like a hormone chaser. Start thinking like a vascular specialist. Support nitric oxide. Reduce inflammation. Feed the system that actually produces erections. One simple food, eaten consistently each morning, can help reopen a pathway your body still remembers how to use. If this video gave you something your doctor hasn't, a real explanation, not just a prescription, then this channel is for you. Every week, I break down the science of aging physiology, what's actually happening in your body after 60, and what evidence-based steps you can take. Hit subscribe and turn on notifications, because the next video covers the second biggest vascular mistake men over 60 make, and most have no idea they're doing it. I'll see you there.